And now for something completely different. When I was a college student and I was taking art history, they told me, I don't know if this is true or not, that a problem that painters got into when they were painting children is that they made them just little adults. And I think the same thing happens with older people. When we paint them, whether we paint them as artists or we paint them in our thinking, is we think them as adults with gray hair and wrinkles. And in fact they're not. For many people, they desire to be the new 90 is 70. I have this saying that as a geriatrician, my goal is to have all of my patients die at the age of 90 after having been shot by a jealous lover. That's not always the case. That's just not always the case. Although somebody told me once that happened to one of their patients. But in fact, some people don't want to work that hard. It takes a lot of work to be 70 at 90. It takes a lot of work, and a lot of people don't want to work that hard. And in fact, that's the reason why people retire. The reason why people retire is that they don't want to work that hard. And that's okay. One of the things in my work, which deal primarily with very frail people, often with incurable diseases like Alzheimer's, et cetera, we've taken kind of a different approach. Rather than us saying, geez, this is what we think you should be at 90, or this is what you should be at 85, it's really about what you think you should be at 85 or 90 or now or for the next 5 years. And there's a whole literature on this and a whole science on this that we are actively engaged in. It's goal setting and goal attainment. So sitting down with somebody and saying, well, you know, there's these people who are these exercisers in their 90s and they're looking fit, they're on television shows and such like that, but, you know, is that what you really want? No, it's not what I really want. What I want to do is watch television with my family, and I want to kind of I want to have people over and visit and things like that, and say, well, let's set these goals up, and what do we have to do to meet those goals? It's kind of like strategic planning. Mm-hmm. And sometimes those values and sometimes those goals may not resonate with me as a physician, or even with their kids who want to see them much more active. But I think when we talk about successful markers of successful aging, you know, if your idea is to be 70 at 90, then those kind of more traditional markers, and I think Marianne did a very nice job of outlining what some of these are really the right thing to focus on. You should be just extending kind of what aging is. On the other hand, that's not for everybody. It just isn't for everybody as we get older. And here, what I would encourage is flexibility. Flexibility in markers of aging. And there's a whole bunch of literature, and Seaman was kind of getting at it, that show that older people are generally happier than younger people. I mean, the last thing in the world that I want to do is go through puberty again. You know, it's just like, you know, awful. But in fact, being able to meet those goals, and nobody lives forever, not yet. Nobody lives forever, and saying, geez, during this phase of my life, what works for me? And then organizing not only healthcare, but lifestyles, social support, all these other things around kind of meeting where you want to be at that time. So the light is getting yellow, and I'm going to stop here.
Well, thank you very much. That was, I think, very...